According to statistics adapted from the American Cancer Society, other than skin cancer, prostate cancer is the most common cancer in American men. About 268,490 new cases of prostate cancer are recorded and about 34,500 deaths. According to the latest WHO data published in 2020, prostate cancer deaths in Kenya reached 1,292, which is 0.49% of the total deaths. Around 60% of cases are diagnosed in people aged 65 or older. The average age at the time of diagnosis is 66 years. The disease is rarely identified in those younger than 40. The number of new cases diagnosed in black men is 73% higher than the number of new cases diagnosed in white men. Black men in the United States and the Caribbean have the highest incidence rates of prostate cancer around the globe. So we've gotten to see the statistics, and it's time to get into the nitty-gritties of the prostate cancer itself. And of course, joining the conversation is Dr. Juliet. Welcome to the show.
Thank you very much.
Habari yako?
Nzuri sana.
Yeah, please do tell us, so what do you major in?
Yeah, so I'm a clinical or radiation oncologist. So that means it's a chemo or cancer treatment doctor. So it means treating patients with chemotherapy and radiation treatment. I'm mainly based in Nanyuki Teaching and Referral Hospital, which is in Laikipia County.
Oh, yes. That's where I stay too.
Oh, fantastic, fantastic.
Yeah, yes. So first things first, what is the prostate and what is the function of the prostate?
So the prostate is a very small gland. It's called the size of a walnut, which is very tiny, but it plays a role in terms of nourishing and helping the movement of seminal fluids that is present in all men. So it's a small gland that is in the pelvis, and it's present in all men, basically.
All right. And so what is now prostate cancer?
Prostate cancer is when patients present with cancer cells, or what we call malignant cells, in this prostate gland, and it is one of the most common malignancies or cancers in men. Yeah, worldwide and also in Kenya.
Okay, so let's get to understand what predisposes one to the cancer.
So actually the main risk factor when it comes to men is age. So men above the age of 50 years will always develop enlarging of the prostate, and sometimes it can be non-cancerous. It's referred to as benign prostatic hypertrophy. It means the prostate gland becomes a bit big. However, as any man becomes older, then they are at risk of getting the malignancy. Less commonly is family history. So you find in some families there's a higher predisposition of them getting prostate cancer. You find that the father, the grandfather had prostate cancer less commonly, but the main thing is age.
And I'm very much curious, what in men that are more seasoned, for lack of a better word, makes them more predisposed to the cancer itself?
So it's not depending on one factor or another. It's just something that happens because as you get older, there are some changes for the men that happen in the prostate gland, where the cells sort of change over time. And usually they become a bit atypical, what means they are a bit abnormal, but that doesn't always mean it's cancer. But as they get older, by the time a man is above the age of 90 years, most likely they will have a few of the cells that have changed and what we call mutated, and therefore become cancer cells.
Okay, so that is why you get that most men who are more advanced in age are more predisposed to it. And I think now it brings us to the question of the importance of actually having an early screening. So let's get to understand that as well.
So screening is a fundamental, not in just prostate cancer, but I'd say in several cancers in both men and women. But when we come to prostate cancer specifically, there are two modalities of screening. So there's one test referred as the PSA, which means the prostate specific antigen. It's a test that is done as a blood test, and it can be done in any hospital to any man. The other aspect is doing a rectal examination. It's called a digital rectal examination to examine the size of the prostate and whether there are some changes or irregularities within the prostate gland. However, that being said, not all men should go for prostate screening. So there are guidelines in place, both in Kenya and internationally, in terms of what you need to do and who is at risk and who needs to be tested or not. So ideally, any man above the age of 50 years should start screening for prostate cancer, and that means the test, the serum test called the PSA, can be done every 1 to 2 years. However, if you have younger patients between the age of 40 to 49 years who have a family history of prostate cancer, so this is a patient who will say, my uncle had prostate cancer, my dad, my grandpa, whatever the relation might be, if there is family history, then for such patients you might want for them to start screening even at an earlier age. Yeah.
Okay. And now maybe going down now to the diagnosis, say one has been diagnosed with the cancer itself.
Yeah.
But what are the very early signs of prostate cancer? How would you know that, you know what, it's time for me to go to a doctor?
Yeah. Actually, as I had alluded before, most men will have enlargement of the prostate, right? And sometimes it's called benign. It means it is not cancer, and sometimes it is cancer. Now, the symptoms are very similar. We call them lower uterine tract symptoms. So that means they can present with difficulty in passing urine. Sometimes they can present with some elements of erectile dysfunction. They can have some pain when passing urine, dripping, whereby it's just little amount of urine that is coming out, and some form of urinary obstruction. So it's difficult to say it's prostate cancer just from the symptoms. The most important thing is when a man presents with such symptoms, they go to hospital. Of course, they do the normal tests, the urine tests and so forth, but a PSA is also done. Now, you remember the test I talked about, screening. Now it's part of, it can help in detection because it's called a tumor marker. It means the prostate gland produces this marker that actually shows that there is a risk of prostate cancer, and above a certain level we are worried about it. Once we do a PSA and we do a rectal examination, then the patients will require a biopsy. Now, only a biopsy confirms whether it's prostate cancer or not. Not just the PSA, not just the symptoms, not just the clinical presentation, but a biopsy. And their biopsy actually guides us into the aggressive nature of the cancer, because some are prostate cancer, you will find patients are called as low risk, intermediate risk and high risk, and only the biopsy can tell us what risk stratification the patient might be in and how the patient needs to be treated.
Okay, and you've mentioned how the patient needs to be treated. So let's go down to the different forms of treatment. I'm thinking that depending on the stage, it could be different. So let us in on that as well.
So for, again, if a patient goes in for screening early enough and is detected to have prostate cancer early enough, less aggressive, a biopsy is done. We do examination to make sure it hasn't spread anywhere else in the body in terms of imaging. Once we've confirmed that, there are several. So the spectrum is quite wide. For patients who we refer to as very low risk, we can actually watch and wait. Yeah. Interestingly enough, we can have some patients where we say, all right, let's just see, because it's a low risk, less aggressive type of cancer. However, as we go up into the scale from very low risk to high risk prostate cancer, then it involves treatment. Now, in terms of treatment with intervention, it's divided into two main modalities. Either patients get surgery, what is referred to as a prostatectomy, where the prostate gland is removed, or they have radiotherapy, which is X-ray treatment to the prostate. And usually, depending on the aggressive nature of the cancer, so the risk stratification, and also how what the patient wants in terms of treatment, then the two options are viable. All right, so sometimes we can give the patients the choice to choose depending on the side effects of both. and what they would want, but some we would advocate for radiotherapy immediately and some would advocate for surgery immediately. So it varies from one patient to the other.
Okay.
Yeah.
And you've mentioned a very important bit, the radiotherapy bit of
Yeah.
it. So what goes on in radiotherapy for prostate cancer patients?
All right, so that is my area of expertise, of course, as a radiation oncologist. Usually for patients with who require radiotherapy, if I can count down on what it is X-ray treatment. So you can go for a chest X-ray and they look into your lungs.
Yeah.
That is a very low dose of radiation, X-rays to the lungs, and you can look at the lungs. However, when it comes to treatment with radiotherapy, we use high energy X-rays. And these X-rays are able to target and localize the treatment to where the prostate gland is, and therefore you can actually treat the cancer cells and reduce toxicity anywhere else in the body. So it's very targeted, and now what has happened is over the years, because of course prostate cancer is quite common, they have been able to put good radiotherapy modalities in place that are able to target the treatment to cancer cells, specifically to the prostate, and less toxicity to the organs around it, and also less toxicity to the rest of the body.
Yeah, and now that you've talked about the different kind of treatment, let's get to understand what's the difference in complications when one, undergoes surgery and also radiotherapy.
Yeah, that's a very important question, because that is something we actually have to tell the patients before they can decide what is the best treatment for them. Right. So then in terms of surgery, the prostatectomy, they remove the entire prostate gland. Usually those patients, the main symptoms that they can present with is erectile dysfunction, because the entire prostate has been removed. Okay, so for younger patients who are in their 40s maybe, then that is something you have to actually really communicate and tell them about, because it can significantly affect their quality of life.
Yeah.
If you're dealing with an older patient above the age of 70 years, then it's different. So that is the main toxicity that's associated with prostatectomy. Now, when we talk about radiation treatment, the X-ray treatment, there is a risk of them having erectile dysfunction, although it's a bit less. Okay, but remember, a prostatectomy, a patient will go into hospital, have the prostate gland removed, and then within about 4 or 5 days, or even less, they are discharged, right? But when it comes to radiation treatment, these patients have to come into hospital every single day for approximately 2 to 3 hours, give or take, minimum, for them to get treatment. So you have to actually tell them that it's not an in and out procedure like a prostatectomy. They have to come in daily, every single day. So usually it's Monday to Friday for about 5 weeks. All right, because the treatment is usually for several days, depending on what treatment regime is being used in different hospitals. So that is one thing to consider. However, when it comes to the toxicity profile, remember where the prostate gland is, just in front of it is the bladder that keeps urine. So they might present with further worsening of the urinary symptoms while they are on treatment. This subsides later on, but this can happen. Now, when it comes to the side effects, we always divide them into two main aspects in radiotherapy. One, we call it acute, so within or during treatment or a few weeks after treatment, duration of about 3 months, or long term, this is several months or years after completion of treatment. So this difficulty passing urine, urinary symptoms, pain during passing urine, that can happen whilst they are on treatment. And because where the prostate gland is, behind it is something called the rectum. The rectum is what allows stool to come out, so they can present with symptoms such as diarrhea. Okay, they can have what is called proctitis, which is the wall and the lining of the rectum can be a bit more inflamed, so they have a bit of pain. They can have also symptoms such as loss of appetite, some fatigue, maybe some nausea, less commonly, but those are the main side effects. The long-term side effects is, of course, erectile dysfunction, but also they can have bleeding that is coming out from the back, sometimes because of the inflammation of the wall of the rectum, and they can also have some intestinal problems. The risks are very low, but then again, we always tell the patient so that they know their entire treatment, because once you get treatment, it's not just that one time when it comes to cancer, it's long term. So all that has to be advised, and the patient can sort of decide what they feel more comfortable with, and we can also advise what we feel which is most comfortable with, and then decide on what is the best treatment. So it varies quite a bit.
Oh, okay. And I do understand that can be a bit difficult for some patients, definitely. But is there a way to actually contain or rather curb those side effects? Is there
Absolutely. Now, as I had alluded before, we are in an era where radiation treatment has been significantly improved. Now there are, and these are treatments that we are doing in this country. We refer to as VMAT. VMAT is a very technical word, and IMRT, very technical words, but what that means is that the radiation is able to be targeted directly to the prostate, and therefore the exposure to the organs around is very low, and that is one of the main modalities that we reduce the toxicity when they are on treatment. Secondly, they can be given some medication to help combat the nausea, combat the diarrhea, and actually most patients are usually quite comfortable through treatment.
Okay.
It may sound very extensive, but to be honest, they are. It's the toxicity profile is very low, and they are able to go through the 5 weeks of treatment very well. Yeah.
Right. And from your experience, maybe having dealt with patients, how have you seen the whole process being, with them having to come for the radiations? Have you seen improvement in character and stuff like that?
So I practiced in South Africa for several years, and then I came back here. And usually what I've seen is that patients are managed very well. And they actually, once diagnosed early enough, they actually have a very good outcome. So they can survive, and once they finish treatment, irrespective whether it's surgery or radiotherapy, a lot of times we just follow them up. They come 3 monthly, 6 monthly visits. We do our prostate specific antigen, the PSA test. We see that they are well, we tell them to go home and so forth. So if there is anything that is concerning, we are able to actually address it quite quickly. So follow-up is there, and the outcome may be good. Yes.
Awesome. Well, there's so much we have to discuss, definitely. But we will be taking a very, very short break. But once we come back, of course, we still have more to discuss with Dr. Juliet right here. There's a lot we need to learn about prostate cancer. So please do not go far. We'll be right back after the break.
You are watching TV47, the home of untold stories.
Check it, you're true. Bro. Check it. No, bro. Ladies and gentlemen, karibuni sana. This is Dr. Funega tonight. My name is the Eagle himself, the Duke of Kakamega. Dr. Funega is my name, of course. You never know who we're going to be bringing. Could be bringing your favorite politician. When are you coming back home?
Stop asking nonsense.
Could be bringing your favorite YouTuber.
Unaniringia sababu mimi hiyo time wala economy ilikuwa imenichapa. Nilikuwa juu ya githeri.
Content creator, celebrity, all of them live on Dr. Funega tonight. To all the ladies and to all the men, you can sort yourselves out. Of course, I leave you. Hujambo na karibu katika habari za TV47 jioni.
Mnakumbuka hii televisheni ni ya waganga kutoka Tanzania.
Kaluma King Herbal Lozenges zinazo nguvu maradufu kutuliza kikohozi, vidonda vya koo na mafua. Kaluma King ni shwari.
Chika mama huyo muharifu kaiba kuku zangu, vifaranga wangu na mayai zote pia kabeba. Haya, chika mama huyo.
Maumivu yakizidi, muone daktari.
Chachisha mechi. Chachisha Mechi. Catch all the 64 games live from Qatar on GOtv Super. Get your GOtv decoder for only 1,999 Kenya shillings. GOtv. Love it.
One step into a home and all we think about is the furniture and colors. But do you ever stop to think about the type of materials used? Well, the floors, worktops, moldings, or the plumbing. Robert Ndungu takes you to different locations, different houses to get what works perfectly for your next home. Every Tuesday at 8:30 p.m.
Sona moja imetengenezwa kwa njia spesheli ili kupambana na maumivu kwa haraka. Sona moja ina aspirin kama kiungo. Sona moja, kitulizo kamili. Maumivu yakizidi, pata ushauri wa daktari.
You are watching TV47, the home of untold stories.
A very warm welcome back to Body Garage. This is the Art of Well-Being, and with me is Dr. Juliet. We are just delving deep into the prostate cancer and everything all about it. And Juliet, we mentioned earlier that, sometimes the cancer may spread to other parts of the body while you're treating the prostate cancer itself. So how is one treated in case of that?
So usually at the beginning of treatment, we define patients in two main ways. One, we can say a patient is curative. That means a patient is going to get treatment targeted only to the prostate. They don't have cancer anywhere else in the body. So those ones we've already talked about, getting surgery or getting radiation treatment. However, on the other hand, you can have a patient whereby we do check the rest of the body and find that there are cancer cells present. A lot of these patients with prostate cancer, the main site that it tends to metastasize or spread to is usually the bones. Okay, and even if patients present with what we call metastatic disease, so it means disease that has spread beyond the gland, the prostate gland, there are treatment modalities present. So those are the patients who we would treat with chemotherapy. Okay, and now again we have many other targeted treatment that are able to focus only to the cancer cells of the patient, wherever it may be in the body, and therefore it reduces the exposure of non-cancer cells or normal cells from the side effects. So chemotherapy tends to affect or treat the cancer cells, but also these patients will have side effects from chemotherapy like nausea, vomiting, fatigue, loss of appetite, and so forth. And sometimes they can have targeted treatment whereby the toxicity profile is less and different from chemotherapy. And there are so many other forms of targeted treatment available out there.
Right.
Yeah.
And I think most people are asking themselves, we've been talking about radiotherapy, chemotherapy.
Yeah.
We've gotten to understand what radiotherapy really is and how it happens.
Yes.
So could you get us in on the chemotherapy bit of it?
All right. Chemotherapy, again, it's a form of treatment. So we most chemotherapy are usually given as IV or given as a tablet. Chemotherapy, there are different types of chemotherapies. There are so many. If I was to start, I wouldn't finish. But chemotherapy, irrespective of the type, helps reduce what we call the proliferation or the growth of the cancer cells. Now, if I could tell you what happens in cancer cells as opposed to normal cells, if a patient has a normal cell, it will divide slowly. But if a patient has cancer cells, they grow abnormally. So they keep on dividing quite rapidly. And that is where the chemotherapy comes in, because it's able to treat these rapidly dividing cells and kill these cells. Less a lethal effect is present in the normal cells, but they can also be affected. So it just kills the cells that are dividing rapidly, as you would see in most cancer cells.
Oh, wow. Wow, so that is how it happens.
Yes.
And how does it get to you losing hair and the fingers and everything? Nails, sorry.
Usually, actually, the toxicity is different depending on the type. So like in the hair follicles, there are cells that are also dividing.
Right.
Remember, the hair grows quite rapidly depending on the type, and therefore patients can present with hair loss because of that. It can affect the gastrointestinal system, so the patients can present with nausea, vomiting, maybe diarrhea. Sometimes they can have numbness of the fingers. Sometimes they can have issues in terms of appetite, ability to extensive fatigue where they're quite tired. But remember, with the chemotherapy, once treatment is complete, usually most of the side effects resolve. Okay, and usually these patients will have chemotherapy if it's given every 3 weeks or so for a total of what we call 6 cycles. And then thereafter, there are some side effects that can prolong beyond, but there are also side effects that are less after the complete treatment. One of the things that I've forgotten to mention is if a patient is found to have metastatic disease, that's cancer that's everywhere in the body, the first thing that is done is they have removal of the testicles. Right, that is called an orchidectomy. And usually why that is done is that the testicles can produce certain hormones that help the cancer cell to continue growing. So the first thing is removal of the testicles, which is removal of the testicles means less testosterone. With less testosterone, which is a male hormone, it means less ability of the prostate cancer cells to divide and spread.
Oh, wow, it's so technical.
And it's technical, and I agree with you, because usually we sit as a team and we decide. Not one doctor decides. We sit as a team and decide, okay, this patient, the best treatment would be like this, and so forth. That's why it's very technical sometimes.
So it's not just anyone who decides, okay, this is the kind of treatment I want. You guys have to really analyze.
Yes.
And I think I love the bit that you mentioned on for younger patients, you tend not to go on the way of, was it?
Surgery.
Yeah, because of the erectile dysfunction, and you're still young, you're youth, so it can be quite tough. But again, since that's like a long-term effect of the radiotherapy and all that, is there hope of actually getting better after some time? Or
for the erectile dysfunction?
Usually,
once the prostate is removed, if they have a prostatectomy, it's mainly they will have erectile dysfunction. It will not get better a lot of time.
Forever.
Unfortunately. If they have radiation, it can get a bit better. But then again, it's not like the end of it all. A lot of times we refer them to the urologist. They can get some medication that helps stimulate and maintain the erectile function. So it's not the end of the line by any means.
Oh, okay. Then I think wives and girlfriends have to be really patient,
and they have to be present. They have to be present. As we discussed, they are present. We're like, where is your wife?
So that they understand.
Yes, absolutely.
Amazing. And I think now it's good that we delve deeper into the coping mechanisms of one who is a cancer patient of the prostate. So what do you need to do? What kind of lifestyle do you need to adapt? The diet and all that.
So this goes out to everyone. With cancer or without, with prostate cancer or without, a healthy lifestyle is important, and that means a good diet. So lots of fruits and vegetables. I'm sure everyone has had this countless times.
Yes.
Eat your fruits and vegetables, very important. Less processed foods. Okay, less very fatty food, less sugary food is very important. And secondly, maintaining an active lifestyle. So maintaining your health, whether be it by walking or swimming or gym, just maintain a very healthy lifestyle and a good weight on you. Body mass index. And of course, thirdly is on you to be able to be taking yourself to hospital as a man, have your prostate checked, have your PSA levels done every 1 to 2 years, and that will definitely improve the treatment and the outcome and any intervention that is required.
Also, I read somewhere that, when you're dealing with cancer, going through the whole treatment procedure, you shouldn't try and change so much, apart from your daily routines and stuff like that, that like they try to advise that you should try to maintain a lifestyle that you're used to, not drifting all the way.
Yes.
So yeah, maybe you can tell us more on that.
So what we normally say is that, first of all, everyone hears the big C word, the cancer word, and it's very scary and very disheartening sometimes, but it is not the end of life. There are so many treatments that are available, but that being said, a patient's positive attitude is number one.
Right.
Because as we treat the physical body, there's also the psychological, emotional, spiritual element to it, which is just as important. So what we tell patients, be positive, take it one day at a time. Sometimes we tend to, our brains can go into overdrive, which is not necessarily the best thing. So just take it one day at a time. Be positive through treatment. Be positive through the follow-up, irrespective of the extent of the disease and what the expectations might be. And at the end of the day, the family support. We are always happy when we see a patient come with the wife, especially in this case, or with the partner or with the children. That family support really allows the patient to gain a lot of strength from within and from outside. And that is very important.
Right. And actually, I'm going to kind of do a little bit of a comparison. We did the child cancer, September was cancer awareness for kids. And we talked about when you actually heal, or rather you get treated for the cancer, after some years it kind of comes back.
Yes.
So we've had that, especially with child cancer cases. I don't know, for prostate cancer, is it also the same?
It can come back. Remember, for kids, you're treating maybe a 10-year-old who might live until they're 70. So the treatment itself, whether it's in terms of chemotherapy or radiation, has a risk of causing cancer in the long term. Right. That is why you find these young children, because they will live for very long, might have a risk of having other types of cancers later on. However, when it comes to the prostate, most of the times it's patients who are above the age of 50 years. A lot of times it's patients above the age of 60 and 70 years. So usually cure is very possible. There's less risk of them having a second type of cancer. There is a risk of the prostate cancer itself coming back, whether it's just where it was treated or elsewhere in the body, but less common for them to have another type of malignancy or another type of cancer, because they don't live as long as the kids would have. And that is the main difference.
Okay. So the fact that it comes with age, and men who are advancing age are more predisposed. Okay. Well, that's good. But maybe as we wind up, I'd love to know, what are some of the things you can do to reduce the risk of getting this particular prostate cancer?
It's difficult because everyone will grow old. That is an inevitability. We are not immortal, unfortunately. But so in terms of prevention, it's difficult to exactly say. Then the main thing is live a healthy lifestyle. And after you've lived a healthy lifestyle, remember, just go for your PSAs. If you're worried about anything, go to hospital, have it checked out. A lot of times I find patients say they'd prefer not to know. And
what you don't know
would kill you, but unfortunately what you don't know will, So the sooner and the earlier they get to hospital, the sooner and the earlier they get screening, the better the outcome and the better the prognosis, for sure. And that is something that I cannot underemphasize. It's very important.
Sure. And maybe many are asking, where can you get the screening done?
Any hospital. Any hospital. And sometimes you might find that in some district hospitals they're not available, but for the most part, most hospitals have a PSA done. And I think if patients have NHIF, it can be catered for by NHIF as well. And in most of course the private hospital, it's available. Unfortunately, I don't know the cost because it varies from one place to another, but it is available anywhere, to be honest. It's not a very difficult test to have done by any means.
And maybe from your experience, in Kenya, for example, what are the survival rates like?
Now, prostate cancer is the most common cancer. all right, in Kenya for men, followed by colorectal cancer, which is cancer of the colon and the intestines and the rectum. Now, when it comes to the outcomes, it's always dependent on the stage. Now, remember at the beginning, I had stated sometimes a patient can be very low risk and that can increase all the way to high risk. Now, depending on the stage and the extent of the tumor and if it has spread to other parts of the body, that is what affects prognosis. Very early stage disease, so the very low risk, and what we call the intermediate risk tend to have a very good prognosis and can be cured. As you scale up on that ladder, of course, there are higher risks of either the cancer coming back or not adequately treating it, but that being said, it is still very much treatable.
Okay, great. And I think with the early screening, that definitely saves a lot of lives.
Absolutely.
Yeah. And I don't know why, but they've mentioned most sites that I've visited, just doing my research, they tend to say that it is the prostate cancer itself is more prone in African countries.
Yes.
As compared to so why
that is very true. It's actually not even African countries. In the United States, you find that there's a higher predisposition for black African Americans. It's just genetics. For some reason, people of African origin tend to have a higher risk of having prostate cancer, and unfortunately it tends to be the more aggressive one as opposed to like Caucasians or Asians. And that is just with regard to genetics. It's nothing else. And therefore, like in the US, you find African Americans tend to be told to start screening earlier on, and therefore the treatment tends to be a bit more aggressive as well.
Yeah, and also in American countries, I hear them talking about more of a colonoscopy rather than,
exactly. For them, colorectal cancer is very big, and for us, prostate is very big. So all globally, there are some malignancies found more commonly in Asia, more commonly in the US, more commonly in Africa, and so forth.
Wow, this has been a wonderful session. I mean, I hate to say it, but we've gotten to the end of that part of the interview. Thank you so much for sharing so much insights, with matters prostate cancer. And I think many people are curious. They want to know all these things, and we've been able to get them right from you. And I think the message you can pass on to everyone is about the screening. I mean, screen.
Absolutely. And I think that's if there's anything to remember out of this is go out there, get your screening, and you will be okay.
Amazing. Thank you so much, Dr.
Thank you for having me.
Anytime. But anyway, ladies and gentlemen, of course, the episode is not yet over. We'll be coming back with more, and that is on health tips. Remember, we've been able to tackle cancers. We've looked at cervical cancer, we've looked at breast cancer, child cancer as well, and prostate cancer is what we were doing today, which is the last episode of our cancer episodes. But of course, we'll be coming back right after the break to tell you all the health tips you need to know when dealing with cancer. So please do not go far.
You are watching TV47, the home of untold stories.
Now, how do you celebrate people who have made great milestones? On this week's episode, we will be joining Women Challenge to Challenge as they celebrate women living with disabilities as their shijas.
I had a short illness, I had an infection, GNT infection, and later I became deaf both years.
Nilitaka kuwa nurse. Nilipoenda shule ya college, nikaambiwa siwezi beba wagonjwa, siwezi kimbia.
Saturday, 7:30 p.m.
Do you dream of working in Germany as a health practitioner? Mount Kenya University, through its affiliate, Equip Africa Institute, has partnered with Hochschule Koblenz University of Applied Sciences, Germany, to train you in healthcare assistant for German hospitals. The training, which targets those who have cleared KCSE and have proficiency in German, will be conducted in 2 semesters, with successful candidates being guaranteed apprenticeship and job opportunities in partner German hospitals. January intake is in progress.
The body of Mr. Namdi Wokeji was found at a beach house this morning.
macho tayemerewa.
To watch this and other Showmax originals, simply add Showmax to your DStv subscription using the My DStv app.
Beautiful Sunday. This is my.
How well do you know what's happening around you? Morning Cafe with heated political debates. Baraza la Siasa.
Hiyo kitu azungumzie, angalie hali ya maisha ya watu.
Informative health discussions. Business, farming. Tasty Wednesday, Fitness Thursday, and Feel Good Friday with amazing DJs, celebs,
waimbaji, kuna comedians, alafu kuna wajinga,
and music bands every Monday to Friday from 6 a.m. to 9 a.m. How well do you know what's happening around you? Morning Cafe with heated political debates. Baraza la Siasa.
Hiyo kitu azungumzie, angalie hali ya maisha ya watu.
Informative health discussions. Business, farming. Tasty Wednesday, Fitness Thursday, and Feel Good Friday with amazing DJs, celebs,
waimbaji, kuna comedians, alafu kuna wajinga,
and music bands every Monday to Friday from 6 a.m. to 9
They come from the interviews that we've had on cancer generally. And the very first thing is please get a clear understanding of your diagnosis. This can only come with you having a good screening done. So be it a mammography when dealing with breast cancer, a PSA test, as Dr. Juliet earlier on told us, on prostate cancer, and on the other side of having a pap smear. You know, she advised me to get a pap smear very soon. I think that's the one most people forget about, but you can always get it so that you ensure that you're on the verge of knowing when maybe you get cervical cancer or any kind of cancer for that matter. For the breast cancer, of course, we were told you can always do self-examination, and the only way to self-examine yourself is when you know how does your body normally look like, how does your body normally feel like. When you get an understanding of your own body, then that can help you to ensure that you get. So the second thing is make sure you accept practical and also emotional support. So we are going to take a trip down memory lane when we did an interview with Catherine on breast cancer. She's a breast cancer survivor, and she got to tell us that the moment she opened up to the husband, the moment she came clean about her situation, that's the time she was actually able to get some help. At first she held it, but after opening up, somehow it helped her, you know, get a way of coping with the illness. So at the same time, it's really important to ensure that you're accepting the kind of help that you need. And I know that sometimes maybe you may not be in a position to find someone who maybe you can talk to and open up to, and that is where the option of joining a support group, be it, you know, women with cancer or stuff like that, just make sure you're in a group of people who are helping you in your journey to make sure you're healing faster, and also getting to the point of knowing that you're not alone. That alone really helps a lot. So take up all the emotional support that you need, because at the end of the day, cancer is more psychological than anything else. So the other point is try your best to manage stress. I think we all have different ways of dealing with stress. It could be you going out, it could be you meditating, it could be yoga, some exercises, whatever it is, make sure that you find a way to manage stress. And the reason as to why you really need to manage stress when you're getting treated for cancer is because the stress hormone actually can lead to those cancer cells that maybe were dormant to reawaken. So that's a really, really important bit of it, because once you're stressed out, and that means that your psychological health is not well taken care of, so that could lead to you not recovering in the pace that you would love to recover recover from. And the other point is to make sure you get enough sleep. I can't stress this enough. You know, the moment you sleep well, even as a cancer patient, you're able to rejuvenate on the next day. You're able to deal with fatigue. And at the same time, you're able to feel much better on the next day. So 7 to 8 hours is what is recommended by most doctors. And at times, you know, with our lifestyles, they could change, and you may not really know how well to manage your time. But the best thing is to make sure you have a timer. And you know, with sleep, once you adapt a certain kind of rhythm, you know, if every day you make sure by around 10 p.m. you're asleep, you wake up maybe the next day at around 8, you set some sort of a rhythm that ensures that you get all the sleep that you need, because that's the only way you get to remain healthy and also aid in the healing process. And the other point is, of course, exercise regularly. And most of the time, I think from the doctors we've talked to, they've explained that during the treatment, fatigue is a very common condition that, you know, cuts across all kinds of cancers when it comes to the treatment bit of it. But once you train your body to exercise, that is how you can get the strength. And at the same time, you get to also control things like weight gain or weight loss, because all through the treatment, you may have a roller coaster of things happening in your body, because maybe you've done a little bit of changes in your diet. The chemotherapy, the radiotherapy could be exposing you to so many toxins that could lead to other side effects, as we've been told. But once you train yourself to exercise regularly, while at the same time maintaining a healthy diet, then that means you can be able to combat those side effects and make sure that they don't bring you down to the brim. And then the other point is to make sure you eat well. But before we even move to the eating well part, the part about exercising, we need to get that it doesn't have to be you going to the gym and lifting weights. At times it could be you being part of events, you know, taking walks, hikes, anything to keep you in a physical, you know, motion and activity, because that is what is really important. Remember, all these things sort of come together to make sure that you're not stressed out, because once you have that physical exercise and once you train your body to always be active here and there, then that means that you won't find a lot of time to sit down and lament and think about so much. So exercising is really important. Even whether you have cancer, whether you do not have cancer, we all know the benefits of exercising regularly, and that ensures that once you're under treatment, then you can control and you can heal much better. So the other point is avoid environmental toxins, and I think this can really be difficult because sometimes you really don't know how to avoid them. They are everywhere, especially if it's in the air you breathe or in the food that you're eating, the water that you're drinking. It can be difficult to maybe control that. But let's get to understand that the ultraviolet rays of the sun, as we had been told in our other interviews, is that sometimes it can really pose a great danger to even our bodies, and not just for cancer patients, but everyone in general. The whole ultraviolet rays of the sun need to be avoided, and the recommended time is usually between 10 a.m., the midday sun, specifically 10 a.m. to around 4 p.m. That sun in between there is not really good, especially for those struggling with cancer or trying to heal from cancer. So try and not expose yourself to those ultraviolet rays of the sun that may pose a danger to your health generally. So the thing about cancer that we can all take from all, you know, the interviews that we've had is early detection is definitely, you know, the only way to save as many lives as possible, because once you have that early detection, you will have that early treatment at the very beginning that ensures that you do not advance to the stages that, you know, may lead to you needing a surgery, leading to you needing maybe a chemotherapy or even a radiotherapy for that matter. But cancer is definitely very, very much manageable. So what we can take up from every episode that we've done on Body Garage is that early detection definitely saves lives. So make sure you get your screening done. Make sure you look at every lifestyle choice that you have. And of course, we were also told by one of the doctors that you don't have to adapt a different lifestyle from the one you're living, because sometimes when you sort of shift to something different, it can really be difficult. So just make sure that you're adapting to a healthy lifestyle, but at the same time, not any different from what you are used to. So this sums up every other episode that we've done in October on the cancer, cases and all of that. We've been able to come to the end of that, but I'm sure you've been able to grasp a thing or two on how to prevent it, on how to make sure that you go for early screening so that it doesn't get to, a worse stage. But of course, stepping into November